Clubhouse, Childline, GibSams, the GHA and newly set up support network Walking Together were present, encouraging the use of their services and less taboo surrounding the conversation on suicide.
Premises recovery through work. And the idea is to get people back into the employment. So if you've been unwell and have been unable to work, you want to be able to feel well and give back to your community. So that is ideally what Clubhouse would like for people to feel well enough to be able to have a job and contribute to their community.
It's a group that we wish didn't exist, but we're glad it does, because it's specifically for people who've been bereaved by suicide, which has its own sort of like stigma and connotations around it, but the group exists to support those people who have been bereaved by suicide.
My brother Bruce died last year. He took his life at the beginning of last year, just before the pandemic actually. It was a very difficult time, and I was struggling to find people to help. But this group have been really, really strong, and there's somebody you can connect with that really experienced it themselves, so they know how to help you.
Children do contact us, saying that they have had suicidal thoughts or thoughts of self-harm, and all of our staff are really well trained to deal with those kind of contacts and support the children in the best way that we can.
Earlier this summer, the mental health strategy was launched by the GHA, which included a number to call for mental health issues.
So far, yes, it's working extremely well. And the feedback from individuals that are using 111 are saying that it is a positive step. One number, they get seen to immediately, and they are put into services that meet their needs, whether that's psychology, counselling, an appointment with a psychiatrist or a GP. So yes, so far it's working very well.
All calls to the 111 are triaged, and the response will depend on the urgency of the situation. In the case of an extremely urgent situation, then help will be discharged immediately.
GibSams says there are still areas of concern.
Younger lads seem to take their lives. We also had quite a few attempted suicide, not completed but attempted. But then unfortunately I've heard, and this is what they tell me, that they end up in hospital and then they're discharged and given an appointment for a month later and they try again. I think if somebody attempts to take his life, they should not be released without the psychiatrist seeing them first. I don't know whether that is being implemented now, but I know from people that it's not been happening, and it's dangerous because if somebody wants to take his life, doesn't succeed the first time, goes home, try again, So it is preventable.
Representatives from the organisations agree there's a lot of work to be done. Meanwhile, there are services that can help anyone who might be struggling. A full list of contact details from the organisations present can be found on our website.